Hi, I'm Dr. Jacob Teitelbaum, and this is part 6 of recovering from chronic fatigue syndrome and fibromyalgia. In this segment, we're going to talk about how to go ahead and get pain relief, because many of you are in horrible pain from the illness, and also how to use exercise to complete the SHINE protocol to restore energy production and to feel better. Let's start with E for exercise as able. Many of you have gone to doctors, also known as idiots in many cases, who have told you, well, just exercise, there's nothing wrong with you. Well, you don't have enough energy to condition, and all you do is crash, and you feel like you're hit by a truck, and you're in bed for the next 2 days. That's why we say exercise as able. Your body can make a certain amount of energy even with the chronic fatigue syndrome. See how far you can walk, even if it's 2 minutes, and feel okay. Leave it to the level that feels good tired after and better the next day, and leave it there for 10 weeks. After 10 to maybe 12 weeks on the protocol, your energy production is going to start to skyrocket, and you'll be able to increase your walking by up to a minute a day. Once you get up to an hour a day, you can increase intensity, biking, rowing, whatever it is you'd like to do. So the key is to do that to restore conditioning, but not to do it to the point where you feel wiped out the next day. So that's just a simple thing. Listen to your body. And remember, no pain, no gain is stupid. Pain is your body's way of saying don't do something. Now, for those of you whose pain is too severe to even walk, consider swimming in warm water pools. That's a good way to start so you can begin conditioning and then move forward into walking as you get better. Now let's talk about pain relief, because pain really is a problem in this disease. Our studies showed that the majority of people were pretty much pain-free by the end of 3 months using the SHINE protocol. Remember that pain is your body's way of saying that something needs attention. Now, if you break a leg, it's pretty obvious what it is. But in most people without an obvious cause, the pain is coming from metabolic problems. And the nice thing is that treating SHINE will make the pain go away in most of you. While you're undergoing treatment, though, there are medications that can be very helpful. Natural remedies such as the end pain herbal can be good, but for fibromyalgia, I recommend going with medications. And I recommend that you begin with a medication called Ultram. Now, most of you have heard that Lyrica and Cymbalta have been approved by the FDA, and they're decent medications. But the reason they've been approved is that they're expensive, and they've bothered to pay the money to put it through the process. Ultram is more effective, 2 tablets 3 times a day as needed, and Scalaxin along with it, because Scalaxin is not sedating. But the Scalaxin helps in half of people, other half it does nothing. You'll know within a week, but it does it with very little side effects. So I begin with those 2 medications. If those do not give adequate relief, then I would consider adding in Lyrica, especially at nighttime. And we like a dose of about 250 milligrams, even though in the studies they needed higher doses for the main effectiveness. That was without doing the rest of SHINE. We find that 250 milligrams at bedtime, and start slow and work up if sedation is too much of a problem, works very well. Cymbalta and a host of other medications, Neurontin and many other, can be helpful as well. My book, Pain Free 123, or my book, From Fatigue to Fantastic, will both go through many different natural and prescription aids that can help relieve pain. So these are good starting points, but know that you can get pain-free. This is Dr. Jacob Teitelbaum, wishing you great health